My presentation is about what happens to people that have dementia with their reasoning and judgment. Our book refers to dementia as a common consequence of several degenerative central nervous system diseases, especially central nervous diseases that affect older adults. It says that they have prevalence impairment in memory, intellect, and cognition. Behavior and personality changes are also noted in patients with dementia. Physical impairments are movement disorders or sensory disturbances. The DSM-4 says that a patient with dementia must exhibit the following: impaired abstract thinking, personality change, impaired judgment, impaired constructional abilities, impaired language, impaired praxis, and impaired visual recognition. The ICD-9-10 defines dementia a little bit different. It says that a syndrome due to disease of the brain, usually of a chronic or progressive nature, in which there is a disturbance of multiple higher cortical functions, including memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. Consciousness is not clouded. Impairment of cognitive functions are commonly accompanied and occasionally preceded by deterioration in emotional control, social behavior, or motivation. It will cause intellectual function to start failing. It will also interfere with the personal daily living in the areas of washing, dressing, toileting, eating, and personal hygiene. In order for a person to be diagnosed with dementia, they need to have the following criteria. They must have an insidious in onset. It must not be caused by delirium, schizophrenia, or major depression. It must be something that's acquired and persistent. It must affect several areas of mental function, and it must be severe enough to interfere with work, social activities, and relationship with others. Several facts about dementia. It begins late in life, increases rapidly with age. 2% of 65-year-olds are affected by dementia, and 20% of 80-year-olds are affected by dementia. It's a neurodegenerative disease that's behind most of the different types of dementias. There's an estimated 47.5 million people in the world that have dementia. 58% of the people with dementia live in low to middle income countries. There's not a known cure for dementia, and they don't know how to stop the process of dementia happening. There are different causes of dementia. All dementias are caused by brain cell death and neurodegenerative disease, a progressive brain cell death that happens over the course of time. That is what is behind most of the dementias. Things like Alzheimer's disease, Pick's disease, traumatic brain injuries, reaction to medications, metabolic diseases, poisoning, HIV infection, Down syndrome. The dementias dementia falls into three categories. First, it has a cortical dementia category, and that is changes in the cerebral cortex. Most common causes of cortical dementias are Alzheimer's disease, Pick's disease. Then the second syndrome of dementia is subcortical dementia. Those are changes in the basal ganglia, the thalamus, and the brainstem. And lastly, there's a mixed dementia. Those are changes in both cortical and subcortical structures. So changes in the cerebral cortex, the basal ganglia, the thalamus, and the brainstem. There's different signs and symptoms of dementia. They have memory that is failing them. They feel disoriented. They have lapse in judgment, difficulty performing activities of daily life. They have a lot of changes in mood. There are three stages of the disease of Alzheimer's. Dementia gradually turns into Alzheimer's disease, and this affects communication in three different stages. The early stage of Alzheimer's is first the sounds. They can use sounds correctly. Words, they emit a meaningful word. Grammar is generally correct. The content, they drift from the topic. They have difficulty comprehending new information. And use, although they may talk too long on a subject, they may be apathetic, and they have difficulty understanding humor. The middle stage, they also use sounds correctly. Words are difficult, thinking of those words in the category. Anomia in conversation. So they have anomia in the conversation, and they have difficulties thinking of words in a category, such as if I say fruits, can you name some fruits? And they will not be able to name things like orange, grapes, and plums. They will have difficulties naming in that category. Grammar, sentence fragments and deviations are common. They have difficulty understanding grammar sentences. Content, they repeat things, they forget topics, they talk about past events. And use, they know when to talk, and they recognize questions. They may fail to greet other people. The late stages here, errors are common in words, but for the most part, they're using them correctly. In sounds, I apologize. Errors are common in sounds. Words are marked by anomia, poor vocabulary, lack of word comprehension. Grammar. Some grammar is fragmented and deviations are common. Some grammar is preserved, but sentence fragments and deviations are common. I apologize for that. Content. Generally unable to produce a sequence of related ideas. Use. Generally unaware of surroundings. The impacts of cognitive changes. There is an impact in communication. Cognition and language both relate to the development and function. Language impairment may interfere with the cognitive process. Cognitive impairment may interfere with language. They also have problems with feeding and swallowing, forget to eat their meals. They may not remember to chew and initiate swallowing. They have a risk for choking. They also have other impacts like neuromuscular or motor planning deficits. There are a lot of neurobehavioral and behavioral symptoms that patients with dementia have, such as apathy. They're self-centered. They avoid social contact. They have difficulties in reasoning and judgment, organization and planning. They're restless, irritable. They have impulsive behaviors. They neglect their previous interests and their hobbies. They have repetitive behaviors, compulsive behaviors like hoarding, doing things over and over, pacing, repeating phrases. They like to check things. So if they go and check to see if they turned off the stove, when they get somewhere else, they don't remember, so they go back and they check it again. They like to wonder. They forget what they're supposed to be doing, and they might just walk out the door and start wondering. They have false thought of jealousy, bizarre in nature. They also have language deficits. They're less concise. They have word finding difficulties, difficulty recalling names, circumlocution. They use jargon, difficulty following and maintaining conversation. They have regression to primary language and bilingual patients, difficulty following multi-step directions. There is no known treatment for dementia, but there are several things and different approaches that can be helpful. There are several vitamins and medications that can be useful to help with dementia. And of course, if you're on a medication that causes dementia, so they would need to take you off of that. And there's a glutamate approach. There's some thyroid hormones that can be used. If you have a brain injury, then or brain tumor, the surgery would take that brain tumor away. That would help with your memory, so with the dementia. Also, there's different kinds of models that can be used for treatment. And there's reversible factors like medication interaction, depression, vitamin deficiency, and thyroid abnormalities. Here are some more treatments used for dementia patients: validation therapy, assistive technology, cognitive stimulation therapy. The aggression shows itself as verbal aggression: hitting, kicking, grabbing, hurting self or others, tearing things up. And then there's common signs of judgment and reasoning. Judgment, they make choices that puts their safety at risk. They cannot evaluate the relative risk of a situation. They have difficulty determining something that's important or something that's unimportant. They cannot think of outcomes of their decision. They misjudge intentions, difficulty judging their ability to complete a task. And then for reasoning, they can't decide regardless of the number of choices. They have a difficult time deciding. They can't decide when there are only a few choices. They can make a small, trivial decision like what flavor ice cream they want, but they cannot make large, significant decisions like who gets the family home. They make choices that put their safety at risk. They're never satisfied with their choice. They need assistance with making decisions. They forget past decisions that they have made. And they have difficulty making decisions or outcomes that are far into the future. And that's my presentation about dementia. Thank you so much.